Good day everyone. I am Janaiza Fela Stimosa Panisa from BSN 212J and this is your student nurse for today. Now we're going to perform perineal flushing. So if we're talking about perineal flushing, it is typically refers to the cleaning or rinsing of the perineal area, which includes the genital area and the anal regions. Practice is often done for hygiene purposes, especially after certain medical procedures or childbirth. It helps maintain cleanliness and reduce the risk of infections in that sensitive area. But before that, we need to prepare all our materials needed to save time and effort. So as you can see, I've already prepared all my materials here. So first, we need a warm water to wash our perineum. Here, our clean gloves, 2 kidney basins, 7 pieces dry cotton balls, and 7 pieces cotton balls soaking cleansing solution, our bedpan, the most important, to receive rinse water, and our draw sheet to line and cover the bedpan, and our working forceps and pick up forceps. And lastly, perineal pad and our trash can. So now we're going to proceed to the perineal flushing demonstration. The most important of all is perform hand washing to avoid cross-contamination. Next, after doing my hand washing, next prior is to performing the procedure. Introduce yourself and verify the client's identity, and also explain to the client what you're going to do and why is it necessary. So, good day ma'am. I am Janaiza Fela Stimosa Panisa and I am your student nurse for today. For your verification ma'am, can I see your wristband? Can you please state your name? Alright. Your birthday? Okay, thank you. So now, ma'am, I'm going to perform a perineal flushing. This is to remove normal perineal secretions and odors, prevent infection or contamination, and also to promote comfort. So, ma'am, please bear with me and also please cooperate with me. Okay? Thank you, ma'am. So now, we're going to screen or lock the door of the patient's room. This is to provide privacy. Alright, so I've already closed the window and the door. Now I'm going to wear gloves to maintain hygiene and reduces risk of spreading infections. Alright, I've already wear my gloves. Next is position the patient on dorsal recumbent, which is backlying position with the knees flexed and spread well apart. This is to provide patients comfort during that procedure. Okay ma'am, let me assist you. I've already flexed his knees. Alright, next is place the draw sheet and bedpan under the patient's buttocks. This is to protect bed linens from potential contamination. Great, ma'am. Now I'm going to put the draw sheet. Okay, let me assist you. ma'am. Now I'm gonna put the bedpan. Alright, in count to 3, please lift up your buttocks. Okay, 1, 2, 3. Alright? So, next, drapes the patient, exposing only part to be cleansed. This is to minimum exposure, lessen the embarrassment, and help to provide warmth. Okay, ma'am. Now I'm gonna open the part that I will be exposing. Next procedure is inspect the perineum, then flush the perineal area with warm water. This is note to particular area of inflammation, swelling, excessive discharge or secretions from the orifice of presence of odor, and warm water is used to prevent chilling and soften or dissolve blood clots. Okay, ma'am, first let me inspect your okay. Now alright, so next, get 7 pieces of cotton balls soaked in cleansing solution using pick-up forces and put it in the kidney basin to maintain sterility. So this is our sterile cotton. As you can see, there's a label here. Okay, I'm gonna get my pickup forceps and get the sterile cotton, and we're gonna put into the kidney basin. Okay, so next, after putting the sterile cotton into the kidney basin, let's cleanse the external genitalia, starting from the midline of symphysis pubis down to the anus always. Remember, never retrace a stroke to prevent contamination. Okay, first, symphysis pubis down to the anus. Alright, so for our second cotton ball, cleanse the starting from the mons pubis in figure 7 to labia minora into anus, then discard. For our third cotton ball, starting with mons pubis in figure 7 down to labia minora to anus, then discard. For our fourth cotton ball, starting from mons pubis to labia minora in figure 7 down to anus, then discard. And for our fifth cotton ball, starting in mons pubis in figure 7 down to the labia minora to anus, then discard. Alright, so for our sixth cotton, cleanse groin, starting from groin, going up the thigh. Then discard and do it to the other side. Then discard. So now, flush perineum thoroughly with sterile water. Okay, ma'am. I'm gonna wash your area with sterile water. Okay. After doing that, using 7 dry cotton balls, dries the perineum with the same strokes as above because moisture support the growth of many microorganisms. So I'm gonna pick my working forceps. And open my dry cotton. So first, from starting the mons pubis down to the anus, then this cord. Next, starting from mons pubis in finger 7, down to the labia majora to the anus, then this cord. Starting from mons pubis in finger 7, down to the labia minora, down to the anus, then this cord. Starting from mons pubis down to the labia majora to anus, and this cord. Starting to mons pubis down to labia minora to anus, then this cord. Okay, next, here in the groin, up to thigh. Then this cord and way to the other side. And this cord. Okay. After cleansing the groin area, remove the bedpan gently and turn the patient to the side. Okay, ma'am, I will get the bedpan. And also the draw sheet. Okay, let me assist you, ma'am. Okay, ma'am. Let me assist you to turn on side. Okay, now I'm gonna pick the working forceps to dry the both bottoms. Then this cord and do it to the other side. Alright, ma'am, let me assist you. Okay, so the next procedure is spray with antiseptic as needed to promote healing. Okay, ma'am, I'm gonna spray antiseptic. This is to promote your healing. Okay. So next, puts the perineal pad with up-down motion as needed to prevent contamination of vagina and urethra from the anal area. Okay, so that's it. That's aftercare of the material used to maintain cleanliness and remove and discard gloves. Alright, record the treatment done to patient and any unusual findings such as redness, excoriation, skin breakdown, discharge of drainage, and any localized areas of tenderness. For documentation process, that procedure was done and means of communication. So that's it for my return demonstration. Have a good day. I am Junai Sofela Stimosa Panisa, your student nurse for today.